Question 1. What is the very first step you should take when you see someone collapse? A. Begin chest compressions immediately. B. Check for a pulse. C. Ensure the scene is safe for yourself and the victim. D. Call 911 or your emergency response number. Answer: C. Ensure the scene is safe for yourself and the victim. The concept being tested here is scene safety, which is always the absolute first priority in any emergency. The keyword very first step emphasizes that before you can help someone, you must make sure the environment is not dangerous for you or the person needing help. For example, if someone collapsed in the middle of a busy road, your first action should be to ensure traffic is stopped or move the person to a safer location, if possible, before beginning care. Remembering this simple rule ensures you don't become another victim yourself. Question 2. When performing CPR on an adult, what is the recommended compression depth? A. At least 1 inch 2.5 centimeters. B. At least 1.5 inches 3.8 centimeters. C. At least 2 inches 5 centimeters. D. No more than 2 inches 5 centimeters. Answer: C. At least 2 inches 5 centimeters. This question tests your knowledge of effective chest compression technique, specifically the required depth for adults. The phrase recommended compression depth is the key, indicating the crucial force needed to pump blood effectively. Compressing at least 2 inches ensures that enough pressure is applied to circulate blood to vital organs like the brain and heart. Too shallow compressions are ineffective, so always aim for at least 2 inches, but no more than 2.4 inches. Question 3. What is the proper hand placement for adult chest compressions? A. On the upper abdomen, just below the sternum. B. On the lower half of the breastbone, sternum. C. On the upper half of the breastbone, sternum. D. Directly over the xiphoid process. Answer: B. On the lower half of the breastbone, sternum. The concept is correct hand placement for effective chest compressions, which is vital for delivering blood flow during CPR. The phrase proper hand placement specifically asks for the exact anatomical location. Placing your hands on the lower half of the breastbone, sternum, helps ensure that compressions are delivered over the heart, maximizing their effectiveness while minimizing the risk of injury to other organs. Aim to push hard and fast right in the center of the chest. Question 4. What is the recommended compression to ventilation ratio for adult CPR when one rescuer is present? A. 15 compressions to 2 breaths. B. 20 compressions to 2 breaths. C. 30 compressions to 2 breaths. D. 5 compressions to 1 breath. Answer: C. 30 compressions to 2 breaths. This question focuses on the correct ratio of chest compressions to rescue breaths for single rescuer adult CPR. The key phrases adult CPR and 1 rescuer are important, as ratios can change for children or multiple rescuers. Delivering 30 compressions followed by 2 breaths ensures a balance between maintaining blood flow with compressions and providing oxygen with breaths. This consistent rhythm helps to optimize outcomes during cardiac arrest. Question 5. How should you open the airway of an unresponsive person suspected of having a spinal injury? A. Use the head tilt-chin lift maneuver. B. Use the jaw thrust maneuver. C. Place them in the recovery position. D. Do not attempt to open the airway. Answer: B. Use the jaw thrust maneuver. The concept tested here is how to open an airway safely when a spinal injury is a concern. The keyword suspected of having a spinal injury is critical because it changes the standard airway opening technique. The jaw thrust maneuver is preferred in this situation as it minimizes movement of the head and neck, helping to prevent further damage to the spine. If the jaw thrust doesn't work, then you may gently use the head tilt-chin lift as a last resort to ensure the airway is open. Question 6. What is the first action to take if an adult is responsive but has a complete airway obstruction, severe choking? A. Give 5 back blows followed by 5 abdominal thrusts. B. Begin CPR immediately. C. Call 911 and wait for paramedics. D. Sweep the mouth with your finger. Answer: A. Give 5 back blows followed by 5 abdominal thrusts. This question is about the initial management of a conscious adult experiencing severe choking, indicated by the phrase responsive but has a complete airway obstruction. The first step is always to alternate between 5 forceful back blows and 5 abdominal thrusts, Heimlich maneuver, until the object is dislodged or the person becomes unresponsive. This sequence is designed to create enough pressure to expel the foreign object from the airway. Question 7. What is the maximum amount of time you should interrupt chest compressions? A. No more than 5 seconds. B. No more than 10 seconds. C. No more than 15 seconds. D. No more than 20 seconds. Answer: B. No more than 10 seconds. The concept tested is minimizing interruptions in chest compressions during CPR, which is crucial for maintaining continuous blood flow. The keyword maximum amount of time emphasizes the strict limit. Pauses in compressions reduce blood flow to the brain and heart, making CPR less effective. Always aim to keep compressions going with as few and as brief interruptions as possible, typically for ventilation or AED analysis. Question 8. You are caring for an unresponsive infant who is not breathing and has no pulse. What depth should your compressions be? A. About 1 inch 2.5 centimeters. B. At least 1.5 inches 4 centimeters. C. At least 2 inches 5 centimeters. D. About 2.4 inches 6 centimeters. Answer: B. At least 1.5 inches 4 centimeters. This question tests your knowledge of the correct compression depth for infant CPR. The keywords unresponsive infant and no pulse indicate that full CPR is needed, and the crucial point is the specific depth. For infants, compressions should be at least 1.5 inches 4 centimeters deep, which is about 1/3 the depth of the chest. This depth ensures effective blood circulation while being appropriate for the infant's smaller body size. Question 9. When using an automated external defibrillator, AED, on an adult, where should the pads be placed? A. 1 pad on the right arm and 1 on the left leg. B. Both pads directly over the heart. C. 1 pad on the upper right chest and the other on the lower left side of the ribs. D. Both pads on the back. Answer: C. 1 pad on the upper right chest and the other on the lower left side of the ribs. This question is about the correct placement of AED pads on an adult to ensure the electrical current passes through the heart. The keyword adult is important, as pad placement can differ for children or infants. Placing 1 pad below the right collarbone and the other on the left side of the chest, slightly below the armpit, ensures the electrical current flows directly through the heart to stop abnormal rhythms. This strategic placement allows the AED to effectively deliver a shock if needed. Question 10. After the AED delivers a shock, what should the rescuer do next? A. Check for a pulse immediately. B. Disconnect the AED and wait for EMS. C. Resume chest compressions immediately for 2 minutes. D. Reanalyze the heart rhythm. Answer: C. Resume chest compressions immediately for 2 minutes. This question assesses the proper sequence of actions after an AED delivers a shock. The critical phrase, "after the AED delivers a shock," signifies that the AED has done its part for the moment. The very next step is to immediately resume chest compressions for 2 minutes or until the AED prompts you to reanalyze, ensuring continuous blood flow while the heart hopefully recovers. Do not check for a pulse right away. Effective CPR is the priority. Question 11. What is the proper rate for chest compressions for adults, children, and infants? A. 60 to 80 compressions per minute. B. 80 to 100 compressions per minute. C. 100 to 120 compressions per minute. D. 120 to 140 compressions per minute. Answer: C. 100 to 120 compressions per minute. This question tests your knowledge of the universal compression rate across all age groups in BLS. The keyword proper rate emphasizes the speed at which compressions should be delivered. For adults, children, and infants, the recommended rate is consistently 100 to 120 compressions per minute, which is fast enough to maintain adequate blood circulation. A good way to remember this is to compress to the beat of a song like "Stayin' Alive." Question 12. If a choking infant becomes unresponsive, what should the rescuer do immediately after calling for help? A. Begin rescue breaths. B. Administer abdominal thrusts. C. Begin CPR, starting with chest compressions. D. Check for a pulse. Answer: C. Begin CPR, starting with chest compressions. This question addresses the specific BLS protocol for an infant who chokes and then becomes unresponsive. The keyword "becomes unresponsive" is the critical trigger. Once an infant is unresponsive due to choking, it means the airway obstruction likely led to cardiac arrest. Therefore, you should immediately begin CPR, starting with chest compressions, just as you would for any other unresponsive, non-breathing infant without a pulse. Question 13. What is the correct way to check for responsiveness in an infant? A. Shout loudly and shake them gently. B. Tap the sole of the foot and shout their name. C. Pinch their arm or leg. D. Shout and tap their shoulder. Answer: B. Tap the sole of the foot and shout their name. This question tests the appropriate method for checking responsiveness in infants, a crucial first step in assessing their condition. The keyword infant signifies that a gentle approach is needed compared to adults. Tapping the sole of an infant's foot and gently calling their name is the recommended method to check for a response without causing injury or excessive stimulation. For an adult, you would typically tap the shoulders. Question 14. What should you do if an adult collapses and is unresponsive, not breathing normally, and you are alone? A. Immediately begin chest compressions for 2 minutes, then call 911. B. Call 911 or activate your emergency response system, then begin CPR. C. Go get an AED, then return and begin CPR. D. Place them in the recovery position and monitor their breathing. Answer: B. Call 911 or activate your emergency response system, then begin CPR. This question outlines the critical first steps for a single rescuer encountering an unresponsive adult in cardiac arrest. The keywords "unresponsive," "not breathing normally," and "you are alone" indicate a dire emergency requiring immediate professional help. The correct sequence is to call 911 first to get help on the way, and then immediately begin CPR to circulate blood until advanced help arrives or an AED is available. Rapid activation of the emergency response system is vital. Question 15. When performing CPR, what is meant by full chest recoil? A. Allowing the chest to return to its original position completely after each compression. B. Pushing down as hard as possible without letting up. C. Leaning on the chest constantly to maintain pressure. D. Pressing only halfway down and releasing quickly. Answer: A. Allowing the chest to return to its original position completely after each compression. This question clarifies an essential component of high-quality CPR, full chest recoil. The phrase full chest recoil means that after each compression, you must allow the chest to fully spring back to its original position before the next compression. This complete release allows the heart to refill with blood, ensuring effective circulation with each subsequent compression. Without full recoil, compressions are less effective because the heart doesn't have enough blood to pump out. Question 16. What is the maximum time you should take to deliver 2 rescue breaths during CPR? A. 5 seconds. B. 10 seconds. C. 15 seconds. D. No more than 1 second per breath. Answer: B. 10 seconds. This question addresses the importance of minimizing interruptions in chest compressions when delivering rescue breaths. The keyword maximum time indicates the upper limit for this pause. Each breath should be delivered over about 1 second, with both breaths ideally completed within 10 seconds to ensure that chest compressions are not paused for too long. Rapid delivery of breaths helps maintain continuous blood flow during CPR. Question 17. Which of the following is considered an agonal gasp? A. Normal breathing patterns that are slow and deep. B. Occasional, gasping breaths that are ineffective. C. Fast, shallow breaths occurring continuously. D. Breathing that stops and starts regularly. Answer: B. Occasional, gasping breaths that are ineffective. This question introduces the concept of agonal gasps, which are often mistaken for normal breathing in someone experiencing cardiac arrest. Agonal gasp refers to an abnormal breathing pattern characterized by infrequent, noisy gasps that are not effective in moving air or providing oxygen. Recognizing agonal gasps as a sign of cardiac arrest, rather than normal breathing, is crucial because it indicates the need to start CPR immediately. They often sound like snorting, snoring, or gasping for air. Question 18. What is the most common cause of cardiac arrest in children and infants? A. Heart attack. B. Stroke. C. Respiratory arrest. D. Drowning. Answer: C. Respiratory arrest. This question highlights a key difference in the common causes of cardiac arrest between adults and children/infants. The keyword most common cause points to the primary issue. Unlike adults, where heart problems are typical, children and infants most often suffer cardiac arrest due to respiratory problems, such as choking, asthma attacks, or severe infections that lead to breathing failure. This is why effective rescue breathing is especially crucial for pediatric CPR. Question 19. If you are alone and an infant is unresponsive and not breathing, after calling 911, how should you deliver rescue breaths? A. Pinch the infant's nose closed and cover their mouth with yours. B. Cover the infant's nose and mouth with your mouth, creating a seal. C. Cover only the infant's mouth with your mouth. D. Use a bag mask device only. Answer: B. Cover the infant's nose and mouth with your mouth, creating a seal. This question focuses on the specific technique for delivering rescue breaths to an infant during CPR when alone. The keyword infant is important because their small facial features require a different approach than adults or children. To ensure an effective seal and deliver air, a single rescuer should cover both the infant's nose and mouth with their mouth. This technique helps ensure that air enters the infant's lungs. Question 20. What is the primary purpose of early defibrillation with an AED? A. To restart a heart that has completely stopped. B. To convert an abnormal, life-threatening heart rhythm to a normal rhythm. C. To provide artificial circulation to the brain and heart. D. To diagnose the cause of cardiac arrest. Answer: B. To convert an abnormal, life-threatening heart rhythm to a normal rhythm. This question tests the fundamental purpose of an AED in cardiac arrest. The keywords primary purpose and early defibrillation indicate that the AED is designed for a specific electrical problem. An AED delivers an electrical shock to reset the heart's electrical activity when it's in a chaotic rhythm like ventricular fibrillation, allowing it to potentially resume a normal, effective rhythm. It does not restart a flatlined heart. Question 21. When should you activate the emergency response system, e.g., call 911, if you find an unresponsive child? A. After 2 minutes, 5 cycles, of CPR. B. Immediately upon finding the child. C. After determining the child has a pulse but is not breathing. D. Only if you have an AED present. Answer: A. After 2 minutes, 5 cycles, of CPR. This question specifically addresses the sequence of actions for a single rescuer encountering an unresponsive child, emphasizing a key difference from adult protocols. The phrase unresponsive child signals that the cause is likely respiratory arrest, where oxygen is critical. For a lone rescuer, it's recommended to provide 2 minutes, about 5 cycles, of CPR first to oxygenate the child, then call 911, as early oxygen delivery is often more critical for children than immediate activation of EMS. Question 22. What should you do if an AED delivers a no shock advised message? A. Remove the AED pads and wait for EMS. B. Continue chest compressions immediately. C. Check for a pulse and breathing. D. Reapply the pads and reanalyze. Answer: B. Continue chest compressions immediately. This question tests your understanding of how to proceed when an AED advises against delivering a shock. The phrase "no shock advised" means that the AED has detected a heart rhythm that will not respond to defibrillation, or no rhythm at all. In this situation, the priority is to immediately resume chest compressions, as continuous high-quality CPR is the most important intervention until professional medical help arrives or the AED prompts another analysis. Question 23. You arrive on the scene and find an adult who is unresponsive and not breathing normally. After ensuring scene safety, what is your next step? A. Open the airway and give 2 rescue breaths. B. Check for a pulse for no more than 10 seconds. C. Begin chest compressions. D. Call 911 or activate the emergency response system. Answer: D. Call 911 or activate the emergency response system. This question focuses on the immediate actions after ensuring scene safety for an unresponsive, non-breathing adult. The scenario describes someone in cardiac arrest. After ensuring safety, the very next step is to call 911 or activate your emergency response system to get professional help on the way. Once help is en route, you can then move on to checking for a pulse and beginning CPR if needed. Question 24. What is the recommended method for delivering rescue breaths to an adult if you do not have a barrier device? A. Mouth-to-nose breathing. B. Mouth-to-mouth breathing. C. Skip rescue breaths and do compressions only. D. Wait for EMS to arrive with equipment. Answer: B. Mouth-to-mouth breathing. This question addresses the fundamental technique for delivering rescue breaths to an adult when no barrier device is available. Recommended method refers to the standard and most effective way to provide ventilation. If a barrier device is not available, mouth-to-mouth breathing is the primary method to deliver oxygen to an unresponsive adult who is not breathing normally. While barrier devices are preferred, direct mouth-to-mouth is still an option to save a life. Question 25. For a child, what is the recommended compression depth? A. At least 1 inch 2.5 centimeters. B. At least 1.5 inches 4 centimeters. C. At least 2 inches 5 centimeters. D. About 1/3 the depth of the chest, approximately 2 inches 5 centimeters. Answer: D. About 1/3 the depth of the chest, approximately 2 inches 5 centimeters. This question tests your knowledge of the correct compression depth for children during CPR. The keyword child indicates that the depth is different from both infants and adults. For a child, compressions should be about 1/3 the depth of the chest, which typically translates to approximately 2 inches 5 centimeters. This depth ensures adequate blood circulation while being appropriate for a child's body size.